Hey there, Kalena from Voice Savvy coming right back at you with another video. So over the next few weeks, I mentioned that we're going to be focusing on the most common vocal health issues that can occur in singers. We're focusing on what they are, the signs and symptoms of them, what to do if you experience them, how to prevent them, and the treatment for each of the individual vocal issues. So last week we focused on vocal nodules. This week we're focusing on vocal polyps. So let's talk about it. So let's talk about vocal polyps. Well, first of all, let me show you a healthy pair of vocal cords so that you can see what they look like without the polyps. Here they are, looking fabulous. And then here's the vocal cords with the polyps. Not very nice. Okay, so let's talk about it. So polyps are just as common as nodules. Polyps, they generally develop on one vocal cord, though they can develop on both. They're similar to blisters, they are fluid filled, and they usually have blood vessels feeding into them. Now, a polyp can be filled with clear fluid or blood. If it's filled with blood, then that is called a hemorrhagic polyp. So how does one go about getting vocal polyps? Well, vocal polyps usually occur due to voice trauma, overuse, or misuse. That's singing or shouting forcibly on a sore throat or husky voice. Now, unlike nodules, which happen over a period of time, weeks, or even months, polyps, they can happen as a single episode, which is pretty crazy, a single episode. So yeah, that's polyps. Let's jump back to the video and talk about some of the potential signs to listen out for. Potential signs of vocal polyps are hearing two pitches at the same time, decreased vocal range, hoarseness of the speaking and singing voice, and vocal fatigue. So if you're experiencing any of these signs, make sure that you get checked out as soon as possible. The sooner, the better. The quicker the diagnosis, the quicker the issue can be reversed. So when it comes to treatment of vocal polyps, surgery will almost firstly be recommended, just because the polyps will not go away by themselves with voice rest. After that, you've got voice therapy, which is all about learning how to use the muscles involved in voice to get the best possible sound. And then it is voice hygiene interventions, which is all about just taking care of your voice, keeping it free from irritants, just doing everything that you can to keep your voice in the healthiest place possible, drinking water, steaming, and all of that. So that was vocal polyps. Pretty crazy, right? But remember, these videos are all about just bringing an awareness of these different vocal issues in order to prevent them. Prevention is way better than cure. But that is it from me. Until next time, I will see you soon. Peace.